Hello dear learners. In the last video, we learnt about music therapy. In today's video, we will learn more about art therapy. We will be covering a number of topics under art therapy. What is art therapy, its related constructs, the history of art therapy, its meaning in detail, difference between art therapy and art psychotherapy, the purpose of art therapy, who all can benefit from it, the clinical approaches to art therapy, the steps involved in it, the techniques and its advantages. So let's begin. Like music, art has been around humans since ancient times. Art as a medium of self-expression is used in creative and expressive art therapy. There are multiple similar sounding and overlapping terms when we talk of art therapy, like expressive art therapy, creative art therapy, art therapy. So let's decode these terms one by one. The term expressive art therapy and creative art therapy are often used interchangeably, but there is a slight difference. While expressive art therapy is more common in the European practice, creative art therapy is more popularly used in Australia. Although both terms can indicate a multimodal approach wherein a therapist uses a range of art forms as a part of their practice. But creative art therapies use specific creative arts like psychodrama, poetry, play therapy, sand play therapy for healing and promotion of health in the patients. While expressive art therapy is multimodal and makes use of different mediums based on Melchiordi's MSSS model, that is movement, sound, storytelling and silence. Expressive art therapists particularly work by integrating these components, moving between one mode to the other. Another similar sounding term is which we call regularly as art therapy. Art therapy primarily refers to visual art therapy. It is an approach that employs visual arts as the therapeutic intervention. It is one form of expressive art therapy which involves the use of different visual art forms for achieving mental, physical and emotional well-being. Now, how this well-being is actually achieved? Expression through art gives an outlet for an individual's feelings and thoughts. It helps in bringing the inner anxieties on the surface and resolving them with the therapeutic support. Before going to the technical meaning of art therapy, let's look briefly into the history of art therapy. It's difficult to pinpoint the exact origin of art therapy or from the historical point of view, but from a psychological perspective, Sigmund Freud and Carl Jung are considered by many to be art therapists' primary ancestors. Their ideas on personality have greatly influenced art therapy. Projective psychological tests based on psychodynamic approaches such as Rorschach, Ingblot test, thematic apperception TAT, draw a man test, draw a person, and other like house tree person, which were developed in the first half of the 20th century, were the important influences on the evolution of art therapy as a diagnostic tool. Now, eventually, the synergy between art and psychology became known as the art therapy. In Britain, Adrian Hill was the first person to officially coin the word art therapy in 1942. Adrian found the positive effects of utilizing art therapy when he was himself down with tuberculosis. He found a way of expressing himself and relaxing with his paintings. During those times, art therapy was mostly utilized by medical professionals and psychologists. There was no formal training or qualifications. Art therapy originated simultaneously in the US in the 1940s with the works of Margaret Nomberg. She is the founder of American Art Therapy Association and is known as the mother of art therapy. She's a pioneer in her field. She called her work dynamically oriented art therapy. And she was the first to define art therapy as a separate mental health discipline and a different form of psychotherapy. Another American artist, Edith Kramer, was another popular figure working towards art therapy education in the US. In 1964, a professional organization named the British Association of Art Therapists came into being in UK. Few years in 1969, the American Art Therapy Association came into existence, giving art therapy its separate identity. The association laid down a system of standards for art therapists and registration and licensing to those who met those standards. Art therapy has now expanded and grown all over the world since the second half of the 20th century. Although Britain and US are still popular for the highly developed art therapy professions. Although art therapy has its origin in the psychodynamic school, over the period it has become quite eclectic in its approach, and art therapists follow different perspectives like behavioral, cognitive, humanistic, developmental, family systems approach. This we will take in detail in the later part of the session. Now with the greater recognition comes public curiosity about what is art therapy, what an art therapist does. So now let's dwell into the meaning and goals of art therapy. Art therapy is a technique rooted in the idea that creative expressions can foster healing and mental well-being. It is based on the premise that the creative process of art making is healing and life enhancing and is a form of non-verbal communication of thoughts and feelings. The American Art Therapy Association, that is ATA, in the 2005, that explains art therapy as the therapeutic use of art making within a professional relationship by people who experience illness, trauma or challenges in living, and by people who seek personal development also. The British Association of Art Therapists, BAAT 2005, they define art therapy as the use of art materials for self-expression and reflection in the presence of a trained therapist. Clients who are referred for art therapy need not have previous experience or skill in art, as the art therapist is not primarily concerned with making an aesthetic or diagnostic assessment of the client's drawing or the image. The overall aim of the practitioner is to enable the client to bring change and growth on an individual level through the use of art material in a very safe and facilitating environment. Here it is important to differentiate between the two approaches of art as therapy and art therapy or art psychotherapy, which you say. Art as therapy involves a belief in the inherent healing power of the creative process of art making. Art making here is seen as an opportunity to express oneself imaginatively, authentically and spontaneously. Art has the healing qualities of getting in touch with one's emotions and one's inner being to reach a higher version of oneself. Thus, this creative process of art in and of itself can be health enhancing and growth producing experience. It can be helpful in improving social skills, improving confidence, developing intellectual capabilities and also communication skills. Coming to the second approach, which is the art therapy. Now, art therapy is based on the idea that art is a way of symbolic communication. That is, signs and symbols are used to express thoughts and feelings that are difficult to be expressed directly or verbally. This approach, popularly called also called art psychotherapy, it depends upon drawings, paintings and other art expressions for dealing with communication issues and emotional conflicts. It involves a therapist analyzing individuals' artwork to know better the underlying issues and problems. The therapist tries to delve deeper into the subconscious being of an individual, trying to know what they are projecting onto the artwork. The basic premise here is that with proper therapeutic guidance and support, art can assist in developing new understandings and insights. It can help identify and reduce communication barriers, inner conflicts and cultivate alternative perceptions that can result in positive changes, personal growth and healing. For example, if a child or adult experiences difficulties in expressing himself or herself verbally, or has apprehensions about expressing his or her true feelings, or maybe hiding their feelings for any reasons, art gives them a scope for self-expression and an outlet for these hidden feelings and thoughts. So this is all about the two approaches of art therapy. In reality, most therapists who practice art therapy, they integrate both art as therapy and art psychotherapy into their work in varying degrees. Now, how does an art therapy session actually looks like? So let's talk about some of the techniques in art therapy. The material needed for art therapy include art paper, drawing sheets, plain sheets, pencils, pens, color pencils, crayons, sketch pens, paint boxes, brushes, watercolor, clay mold and etc. Some of the techniques of art therapy which are there are doodling, scribbling, collage, free drawing, coloring, finger painting, sculpting. The therapeutic goals of these techniques are to explore oneself or express one's inner feelings and explore one's relation with the world. Now, I'll give you some examples of the very specific techniques which are used in art therapy. One is the house tree person. Here the client is required to draw these three in one picture. It shows how the client relates the figure of the person to the other two figures, house and tree, in the drawing. In the second is draw yourself as an animal. The client here is asked to draw themselves as any kind of animal or whatever they feel they can relate to. There can be other than the three wishes. Client is asked to draw three wishes of theirs. It reflects their maturity level and how they desire to attain these wishes. Drawing completion is another. Here clients are given incomplete drawing sheets where a few lines or simple shapes are there which needs to be completed and made into a larger picture. So like these, there are many other techniques used by art therapists for helping clients in expressing themselves through art. Now, having an understanding of the meaning and techniques of art therapy, let us talk more about the goals of art therapy. What is the purpose of art therapy? Now, art therapy involves the therapeutic use of art by the therapist broadly for three categories of people. One who have communication problems, second who suffer from mental health related problems or general challenges of living, and third for those who do not suffer any problems but are generally seeking personal development and personal enhancement. Now, the purpose of art therapy can be grouped into three major categories based on this. One is the assessment, the other is the catharsis, and the last is the growth. Assessment in art therapy involves diagnosing or recognizing conflicts, problem or the issues at hand. What are recognizing the mood changes or the unconscious needs, determining also the changes over over a period of time. All this information aids in the treatment planning and when there is a time for termination. Now, catharsis, cathartic process in art therapy entails two steps. the free and uninhibited expression of one's feelings, needs, conflicts and past experiences, that is one. And second is the recreation of events in present and events anticipated in future. The growth involves, growth in the art therapy is, opportunities for growth which are there, and they are in diverse ways in art therapy. So you can identify the alternative problem solving techniques, okay, which you couldn't think earlier. You can develop creative problem solving through art therapy. There is a skill learning also, so you are learning a new skill. It can also enhance self-esteem and self-confidence, and also it gives you a goal directiveness. Now let's talk about the work settings for art therapists. Where do art therapists practice? What are the work settings for them? There are numerous settings. They can practice in hospitals, schools, community-based centers, therapeutic communities, prisons, and many other places. And who all can benefit from art therapy? There the wide range of clients are there. Children are there, adolescents, families, older adults, individuals with learning difficulties. There can be some specialist field and individuals like offenders, terminally ill patients, patients of Alzheimer's disease, individuals with autism, eating disorders, addictions, or those who suffer from any physical or sexual abuse or any other kind of trauma. It can also be helpful for elderly people, for the disabled, for the mentally handicapped, and for those who have experienced separation, divorce, or marital discord, or even bereavement. Now let's discuss the clinical approaches and methods utilized in the practice of art therapy. There are few clinical approaches to art therapy. So like counseling and psychotherapy, art therapy also uses a range of theoretical models like psychodynamic, behavioral, cognitive, humanistic, developmental, gestalt, family system approach, etc. Most art therapists use combination of these models or theories in their work. That is, they are eclectic in their approach. In addition to these theoretical perspective, there are some contemporary approaches also, like solution focused therapy and narrative approaches also there. They are also synthesized within art therapy. So a detailed discussion on these theoretical approaches to art therapy is beyond the scope for this video. However, we can shed light on them briefly. Let's talk about the psychodynamic approach, which is very common. It had a lot of influence on the origin and development of art therapy, as we know from the history. The psychodynamic approach, and particularly the Freud psychoanalytical view, it focuses on the unconscious thoughts and feelings. Okay, so the art therapist with the psychodynamic orientation believes that the unconscious self is best represented by spontaneous drawings. Art expressions help channelize unwanted urges like anger and other negative emotions. The psychodynamic approach to art therapy may involve free associations, sublimation, or a string and ink painting technique with a client. In a string and ink art, basically the client dips a string in a blue or black ink and makes scribbles with their eyes closed. Then they look for or project an image within those scribbles and try to complete it artistically. In contrast to Freud, Jung focused on collective unconscious and archetypes, as we know. Now, the archetypal art therapy involves paying careful attention to the structure and content of images. It's different from the psychoanalytical Freud's perspective. Coming to the humanistic approach, the humanistic or the person-centered approach focuses on exploring emotional conflicts bothering clients, the self-expression and self-actualization. The therapist here needs to be reflexive, empathetic, and non-judgmental of the client. A person-centered approach to art helps the client to express themselves through art, making them aware that this self-expression will promote personal development and growth. The humanistic art therapy focuses more on the experience of art making and its power of self-transformation and self-actualization, and relies less on the interpretation of artwork, like as compared to the Freud, you can see. So, emphasis here is on the process of art making and what does it do for the client and not the result for the artwork. The assumption here is that the process of creating a piece of art can be theoretic in itself. Coming to the second, which is a cognitive behavioral art therapy, CBAT. We know about CBT. CBT believes in understanding cognitions, including the inner speech and the mental imagery as the precursors to the behavior. In the cognitive behavioral approach to art therapy, artwork is used to help the client to become aware of their negative thought and behavioral patterns, and also to recognize the interaction between their thoughts and behaviors. It can benefit people with anxiety problems, depression, PTSD, and other conditions. For example, take an example. Through art therapy, patients of panic disorder and suppose agoraphobia and GAD, generalized anxiety disorder, they can be encouraged to create images of their fears and also to visualize solutions. Coming to the another, which is a developmental art therapy. Now, developmental approach to art therapy is based on various perspectives, including Freud's psychosocial, Freud's views, Erickson's psychosocial view, object relations view, theory. There is a Bowlby attachment theory. In addition, it draws from the stages of normal artistic development, presented by Longfield and Gardner, Kellogg, and the theoretical foundations of the cognitive development that has been promoted by the Piaget. Piaget theory is very popular in cognitive. So, using these developmental approach to art, it requires understanding of the normal stages of artistic development and its graphical characteristics. Now, this is helpful to identify and spot deviations in content and form of art expressions for a child of a particular age. Assumption here is, like other cognitive skills and abilities, artistic expression is also a sequential process. For example, in an art therapy session with a 9-year-old girl with a history of physical abuse, art therapist will observe that does the child create art form appropriate for her age, or is it more characteristic of a 5 or a 6-year-old children. Developmental art therapy is commonly used with children, but it may benefit individuals of all ages, and also people with physical handicaps, cognitive dysfunction or developmental delays. Other than these, there are art therapy approaches based on Gestalt, phenomenological view, existential, solution focused, narrative theories, and a combination of these as the multimodal approaches. Now, like art therapy, like other therapies, art therapy also involves some of the steps of initiating, continuing and ending the therapy. So, let us talk about the steps in art therapy now. Art therapy follow a few steps. Like other psychotherapies, the first is the establishing rapport. It starts with the rapport formation and the assessment of the problem. Here the therapist collects information about the client, works on the suitability of art therapy and decides on the specific technique of art therapy to be used. Then in the next step, the therapist explains about art therapy to the client and how it will be used in the therapy. It is important here to clarify to the client that no prior skill or artistic ability is required for the therapy, and that client must be genuine, spontaneous and feel free to express himself or herself through the art form. In the next, the client is encouraged to involve oneself in the specific technique of art therapy and express freely in the process. The therapist discusses the product of art and its content with the client to help the client derive meaning, gain a new understanding, see alternative perspectives, or resolve issues and conflicts. At the end, there is a termination phase which is characterized by the decision to end the therapeutic relationship. So, these are the steps involved in the art therapy. The last part of today's session is the advantages of art therapy over the other therapies. So, the first one is that art therapy offers the opportunity to work with many different client groups. It can be made available to a wide variety of people with a multitude of different problems, needs and expectations, as we have seen above. The second is almost everyone can involve in art if encouraged to not expect images to be artistically correct. And it can be used as a means of non-verbal communication, which we have seen. It can be used as a means of self-expression and self-exploration. A picture is often a more precise description of feelings than words, isn't it? And can be used to depict experiences which are hard to put into words. The process of doing art can sometimes help people become more aware of feelings which were previously hidden from them, and also release these hidden feelings like anger and aggression. The existence of a picture as a separate entity means that therapist and client can relate to each other through looking at the picture together. And it can be enjoyable, and this may lead to shared pleasure and to individuals developing a sense of their own creativity. So, we see there are a lot of benefits of using art therapy. This brings us to the end of this session. Hope you had a good learning experience and gained interest to explore more about art therapy. Thank you.